Don't know me, my name is Funmi Aina, and it's a privilege for me to be taking us through this class. Please, my co-hosts, can you help to admit people? Yeah, it's a privilege for me to be taking us through this class. Yeah, I've been a doctor for many years, over 35 years actually, well over 35 years, but I didn't put the exact year because I said, let them, this old mama, what is she still doing? Just joking. But yes, and I'm actually retired from employment, from full-time clinical practice, but I want to remember what my downline, my success partner, John Onomiya, said yesterday. He said something about, about retirement being you're retired into, not from what you were doing into somewhere where you have impact, so I like to see myself, yes, I'm retired from what I did for many years, government, clinical, medical, administrative practice, but now into pursuing other, complementary talents, so to speak, and if you can hear me, I don't know why it always sounds so silent. If you can hear me, please type, I can hear you. Oh, okay. So sorry. I didn't realize I was muted. Please, where did I stop? Where did you stop hearing me? Yeah, okay, you can hear me. Thank you. Yeah, so I was saying that, yeah, I'm retired into doing other things, not retired into sitting at home, crossing my legs. No, 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 not at all. And it's really a privilege for me to be here. So I know that sometimes some people ask me, that hey, doctor, how come you're involved in this, and there are many reasons. First of all, I mean, network marketing is something I stumbled across about 10 years ago. Well, before then, but seriously 10 years ago. And I really love the industry. I feel that, honestly, everybody should be involved in a network marketing business, whether part-time or full-time, but you should. That's my belief. But about quite a number of years ago, during one of my postgraduate trainings in the Liverpool School of Medicine, Tropical Medicine, affiliated to the University of Liverpool, that was the first time as a doctor I came in contact with some concepts that sort of paved the way for me to embrace herbal, natural medicine. Normally many doctors don't. Actually, many do, but they don't want to come out and say they do. That's the truth. Many do, but they don't want to come out. I don't know. Maybe they feel their rep is at stake. I don't know. But the free radical theory was something, I don't know whether we were really taught in medical school, but during that course, I was introduced to that. And there I knew about antioxidants. And so that sort of paved the way for me to be able to embrace, try to understand, and be involved in natural medicine. So that is it. So today, let me share my screen. Just a minute. Yes. So today, this is part of our, just a minute. This is part of, can you see my screen, please?
Yes, ma.
Okay, thank you. Yeah, so today, this is the second class
We
in
can't see
our...
your screen yet, ma.
Oh, you can't? Oh,
Not
okay.
yet.
Oh, okay. Sorry. Let me... Just a minute. Oh, okay. Okay.
It's up now.
Okay.
Yes.
Thank you. Okay. Thank you. So today this is the second class in the course on herbal medicine. And yesterday we heard from MI an amazing class on introduction to herbal medicine, and how, herbal medicine, that it has to do with plants, it's natural. We learned so much. And today we're going to talk about how to engage our potential customers. The goal of being, of herbal medicine with us, the goal is to be professional in what we do. And you see, Green Mondays is basically product driven. We have some services, but we have an amazing range of products, herbal products that have been helping to prevent, even cure different ailments, ameliorate and cure different ailments. And while research is still going on in the area of herbal medicine, we all know the different, the benefits that we ourselves and our customers have received from these products. And, we've been talking about being professional network marketers or network marketing professionals. And I believe that being a network marketing professional in Green Mondays may be different. May not be totally the same as being a network marketing professional in another company. Why do I say this? Because in addition to the network marketing attributes, the professional network marketing attributes that we need to have, with Green Monday, we need to exhibit, because we have a natural, a health-based, so to speak, healthcare products. Even if we are not health professionals, we need to exhibit professionalism in the way we deal with our customers, in the way we build our network, and we need to be effective. I believe that part of being a professional is understanding that there are different professionals, understanding that different professionals, different products have their roles. What am I trying to say? I'm trying to say that being a professional, a network marketing professional in a herbal medicine space does not discountenance or replace medical treatment. Neither does medical treatment exist without needing sometimes to have complementary herbal medicine. I think you understand. So we need to show our customers that we have an understanding of the herbal products we're marketing. We need to also show them that we want the best health for them. We want their health to be, we want preventive. We want, if they have a challenge, for it to be sorted out. We want their health to be maintained. And we need to help them to see that we're not just, it's not just about making a quick buck here and there. It's not just about the money they're going to pay, you know. We also help, you know, just like I said earlier, what we're doing is we're aiming to use our natural herbs to complement or supplement the treatment of their condition. In some cases, there will be people who will decide that I don't want orthodox medicine any longer for different reasons. Well, that is their choice. And in that case, we have an alternative for them. Of course, we also need to be in the space, we have enough knowledge and experience to know when we need to actually send them back to their doctor. So, like I said, and then we need to understand the benefits of herbal medicine in general and in specific our own products. And know that every, how do I put it? There may be some limitations. We need to understand them and understand how we go about relating with our customers based on that. We have to have confidence. We have to have confidence in what we are marketing. And this is part of what we're going to talk about today. So I'm trying to change my screen. I don't know. Change. Sorry. I need to stop sharing a bit. Sorry, I don't know what happened. But, okay. I can't seem to change my screen. Please give me a minute. Yes, okay. Yeah. Sorry for that. Yes. So, yeah, so we have to have confidence in what we are marketing. You know, today, what we're going to, what I would like us to gain today is knowledge about, you know, we're going to be able to know as much as we can about our customers, and we're going to be able to understand different parts of the body within our scope to be able to actually visualize what is going on. If you're following me and you can hear me, please can you type, we can hear you. I can't even see I can't even see where, okay, the chat box. I can't see the chat box. Please, can someone tell me if you can hear?
Yes, we can hear you very clearly, ma.
Okay, and you can see my screen. Thank you. Yeah. So today, we're going to learn to know as much as we can about our customers. You know, there is the need to ask as many questions as possible. Sorry. Yeah. You know, as many questions as they're willing to answer. Why is this important? First of all, it can point you in the direction of what is needed, you know, for the customer. If you ask as many questions as possible, you'll be able to, even without having a medical training, you know, you would have an idea. It would give you peace of mind as to what needs to be done. And what do I mean? So I give you an example of a couple who maybe they've been married for 4 years or 5 years or 6 years or whatever, and they're looking for the fruit of the womb. Asking as many questions as possible will help you to know that, wow, okay, this couple has done everything they need to do and medically, and nothing has been found to be wrong. We call it unexplained infertility. You would know that, yes, this is a perfect perfect candidate for reader restore and reader fire. Or maybe you find out that they've had the woman has hormonal imbalance, or the man has a challenge. You would know by asking several questions, you know. And then another thing is that you will have enough information when seeking further advice. And I say this because sometimes, I mean, not sometimes, a lot of times, at least once a day or more than that, or sometimes 2, 3, 4 times a week, I get private calls or private buzzes. I don't mind, you know, about, oh, there's a patient, there's somebody who has this and that. And, you know, sometimes I ask, okay, so what about this? Oh, I didn't really know. Oh, what about this? So it will help us to be able to know, to be able to ask as many questions, the right questions, you know. Now, this is just the beginning of us being able to engage with our customers, our potential reader customers. We're just this particular training today is just the beginning. I know that going forward, we will have more. It cannot be done in one day, but we're going to start to learn how to ask questions, how to engage with them, and even have an idea of, hey, is it this area? There could be a challenge and all that. Another thing we're going to be able to do is to understand different parts of the body, you know, understand within our scope and visualize what's going on. Because sometimes I know some people, okay, somebody comes to tell you about, oh, the prostate gland, I have prostate. Maybe some of us may not really be able to think in our mind, where is the prostate gland? What other things and what other organs are nearby? Could there be any problem? Now, this is not to attempt to make us doctors or to, but we do need to, we need that information. Don't you guys see when CM is talking about free radicals, you will think he had a qualification, a master's degree in that. So we all need to be knowledgeable and understand a lot so that we can give our customers the best. Now, in engaging with our customers, you know, in engaging with our customers, we need to be proactive. And what does it mean to be proactive? It means to act in advance of a future situation. That's one of the definitions of being proactive, and that's the one I choose to use here. How can a Green Mondays distributor / recommender of reader products be proactive? We need to know our products very, very well. You know, if you've been in this business for 1 year, 1.5 years, by now, we should be able to know our products. And it's been amazing. The company has provided numerous resources. We have YouTube videos, we have slides on product trainings. I know many of us, even in my team, we've had product trainings and all that. So we have these resources. I want to encourage us to use them. Now, there is a document called the usage and dosage document. It's in the FAQ Telegram group. You know, I'd like to encourage us to use this, to look at it. I mean, to check. I find that sometimes I get the question, or I see the question, oh, this person has this condition. What is the dosage of reader? Now, reader bitters and the others, they're natural products. They are not a pill for an ill, so to speak, so that, oh, okay, in left-sided headache, you use 2, in down-sided headache, you use 1. No, it's not like that. We have a dosage regimen, and it's been documented. And I want to encourage us, to look at those documents, to have them, if possible, print them out and have them with you, so that you will be. And then when there's a challenge, maybe a person does use the product at that dosage recommended, and there's a challenge, and then you can escalate to any of the members of the medical team. Likewise, we have the 90-day plan, the 90-day plans for the different products, for the different product combinations, usually reader bitters, balm, and a variant, maximum of that. Please, again, let us look at those. It's very comprehensive. Then there's another comprehensive document. It's called the A to Z of diseases and reader options. That is something I think everybody should print it out, because again, I've had a lot of questions. Oh, can reader be used for this? Can reader be used for that? And that document shows everything, every condition, or I'm sure it's at least 99% of conditions that reader can be used for. But saying that, we are evolving. This, the use of reader, what reader can be used for, is evolving. Sometimes we may not even know until we try, and there are few conditions where maybe one cannot use reader. But if we try, we may not know until we try. Then there are FAQ videos. Again, those are on YouTube. There are quite a number of them. If we have those, we might be able to not necessarily ask some questions that are being asked because they're already answered there. And just to mention that a lot of quality time has been spent by different people on putting these resources together. Now, so we now go to the meat of what we're talking about today, engaging with our customers. And I'm going to talk to us, discuss under 2 sort of headings. The history. We in medicine, we call it history taking. But basically what it is questions to ask. What are the kind of questions that we need to be asking our customers, those who are willing to, I know that we're going to have different different types of customers. We're going to have some who are just going to buy reader and take it and go and come back, and say it was fine or something. But we're also going to have those customers that we're going to have to engage with over a period of time. Maybe their condition has been more long-standing or is more serious, their complications. We might need to engage with those people. And this is where your professionalism comes in. And so we're going to talk about history, questions to ask. And then we're also going to have a little anatomy lesson today. We're going to see some of the parts of the body in relation to the others, so that we can, in our mind, be thinking, it can stimulate our thinking. Of course, when you have a thought and you're not sure, you feel free to ask any of the doctors or other members of the medical team, where you have a challenge. So we're going to start with history. So history, like I said, when I say history is the questions that you want to ask. And these are some of the questions. If somebody came to me and said, somebody took reader and did this, I would want to know the age. How old is the person? Is the person a child? Is the person a teenager? Is the person a young adult? Is the person a man or a male or female? Because if the person is male or female, you would start thinking about, okay, they're in the reproductive age or they're going near menopause. So the age is very important. And then the gender, of course, that's either one or the other. Well, these days there are different genders, you know, that people identify as, but in our culture, mostly it's male and female. So then you want to ask, what are the person's complaints? What are they? You know, and there are different complaints, you know, and when we look at the slides on the of the anatomical parts of the body, we'll talk more about different complaints. But when a person gives you a complaint, you want to know how long has it been? Because if something has been started yesterday, the way it will be approached will be different from something that started 2 years ago. Is it severe? You know, what's the severity of these? That means that, is it just mild? Is it moderate? Or is it severe? It's good to know those, you know, so that will even help you to assess when they've taken the reader. Okay, it was mild, it was severe before, even though the pain has not gone, it's now mild, you know. Then, very important, has the person had a medical assessment? Has the person seen a doctor? You know, has the person seen a doctor? If the person has seen a doctor, has the person been seeing a doctor for it? You want to know. Has the person had any investigations? This again is important in certain conditions where it would be good for us to have results of investigations before and even after. And so that's why it's important for people to ask whether there have been investigations. So for instance, a woman who has fibroids. I know we've been seeing a lot of people who have had scans and all that. The person takes Restore and Reader Bitters for 3 months, and you want to know, has it had an impact on the fibroids? A man who has, or anybody who has an infection, the infection has been a stubborn or recurrent infection, they had a test done. You know, at this point, I would like to say that the result of a test is not, how do I put it? You cannot, seeing a test may just tell you this is what the test is. If the person has not been properly assessed, you might not be able to give a full picture of what's going on with the person. I just wanted to drop that in. Then another question that needs to be asked is, what is the diagnosis? What if the person has seen a doctor? What is the diagnosis? I mean, this is also very important because we need to know. We need to know that this person had this condition and the person hadn't had relief before, but when they took Reader, they had relief. But we need to put a name to those conditions. And so it's very important to ask our clients or our customers, if they've seen a doctor, what is the diagnosis of this? And then you want to find out what medications they were prescribed. Did they use them? Did they use them as prescribed? So you want to know that, okay, the person actually, maybe the person didn't comply with medical prescription, or the person complied and still didn't have relief. And then their response to those to that treatment. So all this will help It's just good to have this information. Now, the truth is that it is a bit beyond the scope of, it's definitely beyond the scope of this class to be able to teach people to tie the duration to the, the complaints to the diagnosis. It's beyond the scope. Of course, one would have to go to medical school for that. But I believe that having that information will help, even if you just have it, so that by the time you are talking to the medical personnel you want to seek further advice from, you will have it at hand. Please, if you are following me, please type "I'm following." Actually, I can't even see where this, please, can somebody tell me they're following? I don't know where this, oh, okay, I can see.
Following you bumper to bumper.
Oh, thank you very much.
You click on top of your window, you will find
Yes,
the chat.
yes, I've just seen it now. Well, yeah, I've just seen it now. Yeah, thank you. Okay, great. Okay. So we've talked about general history. So those are questions that you would ask, whether, whether it's the abdomen, whether it's the kidney, whether it's, you would ask those questions generally. So now we're going to look at different parts of the body, and I've put them out in a midway between medical and non-medical way, because I know that there are many non-medical people here. I don't want to overwhelm or confuse anybody, but I'm going to talk about different parts of the body, what could come up, the questions we may need to ask, and even just for us to see what these parts look like in relation to one another. So somebody has a problem with their chest, is chest pain or something. We'll know from here that basically in the chest, you have the lungs, we have the heart, we have the blood vessels. You want to find out if somebody has, say, oh, some people would say, oh, it's heart pain, it may be the heart, it may not be the heart, but you want to ask, where is the pain? Where exactly is the pain? We usually have to ask, is it on the left? Is it on the right? Does the person have cough? I mean, there's so many questions we can ask around cough. I can tell you about 10 questions that we can ask about cough. Is it sudden? Is it continuous? Is it, is it productive? Is it dry? There's so many questions around cough. But yeah, it will be suffice to ask the person, do they have cough? And related to cough is difficulty in breathing. So it'll be good to ask that, okay, yeah, you have cough, do you have difficulty in breathing? And then, does the person have a fever? Like I said, I would, in this forum, it would be difficult to ask, for me to say all the things you need to ask. Who was I telling yesterday that if a doctor is we call it clerking. If a doctor is going to clerk a patient properly, it will take at least 45 minutes for one patient. So that will show you that we might not be able to talk about everything. So the chest, and you also know that you can see from this, I believe you can see my screen. You can see that sitting under the lungs is the liver. On the other side, on the right, you can see and that's the left of the person, you can see the stomach. So you can see all these organs, how near they are to each other, how they are in relation to each other. Then we go, and then we also know that on the chest is covered by the rib cage, and there's skin and there's muscles. So if somebody has chest pain, it could be coming from any of those. So we just need to ask, Then we have the abdomen. And again, maybe the person would complain of pain, and we want to know where exactly the pain is. We want to know how long. And if we remember the previous slide, is it severe? You know, there are, if a person is having severe abdominal pain that is continuous, it's important to get them medically assessed. If it's sudden, severe, you know, then is there a swelling? Is there a swelling in the abdomen? Is there, what are their bowel habits? Meaning, are they going to toilet normally? Are they going to toilet frequently? Are they not going to toilet? Is it watery? Is it 5 times a day? Is it 15 times a day? So these are different questions it will be good to ask, you know, so that we know. So that's basically the abdomen. Then the pelvis. The pelvis is the lower part of the abdomen that houses the reproductive organs. And so we can see here, we can see the uterus, we can see, sorry, just a minute. Yeah. Somebody is saying swipe left. Can we all see? Can we see? Hello?
See.
Pardon? Hello?
We
Okay, you
can
can
see.
see. Okay, thank you. So this is a pelvis in a female, and we can see the uterus. So when somebody has fibroids, you know that it's somewhere here, you know, in the uterus. It can be on top, it can be at the side, it can be inside the uterus, it can be in the wall of the uterus. Then you can see the ovaries. You know, if somebody says, oh, they were told they had an ovarian cyst, you can picture now, this is where the challenge is. And you can see the fallopian tube. If somebody says, oh, they were told their fallopian tubes were blocked, you can see that it means there's a blockage so that the egg cannot travel to meet, and the sperm comes into the vagina and meets the egg that travels. If there's a blockage, they cannot meet. So an understanding of this can also help us, you know, as we engage with and advise our customers. Somebody has a discharge from the vagina, you can see where it's coming. It's coming from either the vagina or the cervix or the uterus. We can see those. So I know that we're going to have these resources so that we can keep looking back at them. Then we look at the pelvis in the male. You know, I know that what a condition that is very, very common in males is prostate enlargement, either benign, which is non-cancerous, or cancerous. So we can see this is the prostate gland here. And, you know, when a male is complaining of pain in that area, you can see all the organs. There's the bladder, there's the prostate gland, there's the testes, there's the penis. You can see all these organs and visualize, okay, this is where they're having pain. There could also be pain here. You want to find out how long, you know, you want to find out, is there discharge? Is there discharge from, apart from urine, from the urethra? This is the urethra is the tube that takes the urine out of the body. And you want to find out if there's erectile dysfunction, how long, you know, ask also maybe, you know, you relate it to those general questions. Somebody says they have erectile dysfunction, how long, are they on any medications? You know, it could be medications causing it. It could be the condition they have. It could be psychological. And so then I just brought this slide out to show the urinary system, where the kidneys are, you know, in relation to other organs. You can see the kidney here at the back. It's at the back, but it's also in the abdomen, but at the back. So we can see that you know, and when we talk about the urinary system, the conditions that people can complain of, they can complain of pain when passing urine, they can complain that they go to urinate frequently, you know, more frequently than normal. You could complain that the volume, they have passing a lot of urine or very little urine, or maybe there's blood, a bloody discharge, or maybe it's just a discharge, maybe like a pus-like discharge. So these are questions we can ask, or we should ask, depending on the person. That is in addition to the general questions. Then the head and the neck. Of course, people complain about headache, you know, and when somebody says they have a headache, a doctor will want to know where the headache is. Is it frontal? Is it occipital? This is the region. I mean, these are the different areas. What part of the head, you know, does it affect your sleep? Do you feel dizzy? These are symptoms that relate to headache as well. Does the person have seizures? That's convulsions. You know, we want to know, maybe the person has epilepsy or has had an injury that make them to have a seizure. So those are questions in the area of the head and neck. Then we have the musculoskeletal system, that is the joints, the muscles, and of course, people, we get a lot of people complaining of pains, joint pains, arthritis, low back pain, you know. So you want to know whether where the pain is exactly, and you know what we might want to determine, is it in the muscle or in the joints, but there may or may not be an immediate way of determining that, but it could be muscular, it could be joint, inside the joint or inside the bone. Is there a swelling that is related to that? Has the person had an injury? You know, so it's always important to bear in mind that if somebody suddenly starts having pain, you want to know whether there's been, we call it a history of trauma, that is an injury. Then the skin. I know that again, we come in contact with people who have skin issues, and are they rashes, are they boils, what is the color? You want to know, is it itchy, is it painful, is there a discharge? We call it a purulent discharge. Is it pussy? You know, now, is the rash located to one part of the body, or is it all over the body? Maybe somebody just shows you a rash here. Of course, you want to know, is it all over the body, or is it just there? So these are just a few of the questions. As I said, this is a beginning of us being able to engage, of us learning how to professionally engage our customers. And before I go on, I don't know, I want to pause before I conclude actually, but I'd like to pause to find out, are you following me? Do we have any questions? If you have a question, you can be unmuted, or you can, we can give you voice so that you can ask. Okay, yeah, thank you. You're following. But does anybody have any questions? Any questions? Okay. I don't see any questions. So, but you know, so for today, this is what I have for us, you know, basically, you know, just to help us to see that we need to engage our customers in a professional manner. And like I said, part of being a professional is recognizing the different roles. And our role here really is to find out how our product can help our customers, and how if they need to see their doctor, then they need to see their doctor. You know, being able to recognize that, being able to recognize what, I mean, it's very interesting that we can see that the reader range is doing a lot of things. It's been amazing hearing the testimonies, honestly. And I know that we're still going to discover more. At the same time, there are times that we need to, it's going to be complementary. It's not going to be only reader that is going to solve that person's challenge. Sometimes it's going to be, sometimes it's not going to be. And part of being a professional is learning to recognize that. You know, so as I conclude, you know, we need to know our products. You need to know the content. Tomorrow, Dr. Onifade is going to be talking to us about the content of our products and why they work. But sometimes it's good to even know why, you know, to understand why. I remember, it reminds me of when a number of years ago, my air conditioner technician used to say, doctor, people should not be sweeping when the AC is on. And I'm like, yeah, okay. And then sometimes we sweep, you know. And then one day he came to our house, and what he just did was that he took a handkerchief, the air conditioner was on, and he spread the handkerchief over the vent of the air conditioner. And the handkerchief stuck on the air conditioner. It was like sucked in, and it stuck there flat. And he said, doctor, you see, the way this handkerchief is being sucked in, that is how dust is sucked in to your air conditioner when anybody is sweeping when it's on. And honestly, that was a big lesson for me. That from that day, because I understood why. Okay, why was this guy telling me not to sweep when the AC is on? Now I know why. So when you understand why, it really helps a fuller understanding, and it helps us to put those products to better use. We need to understand that our value, the value we need to give. I mean, for those of us who have been in the training since last week on wealth creation, you know, one of the laws or one of the things we learned is that you should give value beyond the cash you collect from somebody. And so once we understand that, we'll know that it is not just about, oh, take a bottle of reader and go, give me my 2,500 or give me my 5,000. No, it's all, give me a carton. It's about engaging with our customers. First of all, it will help them. So we're giving value. Another thing is they'll come back. They'll come back to you if you're giving them more value than just that bottle of reader or reader bitters or fire or whatever. And then we need to understand we need to be clear that it's about complementing and supplementing their medical care. We're not in competition. Well, like me, I can't be in competition with myself. I'm a doctor, and I'm also involved with using herbal medicine. It's about complementing. It's not about talking down at anybody, at any field. You know, it's just for each part of being a professional is understanding the roles. And I know that as we move forward in this journey, being educated, learning, we will be able to clearly understand those roles and also understand where there's sort of a synergy as well. So we've come basically to the end of this class, and I just want to encourage us, engage with your customers as a professional in Green Monday and as a professional that is promoting, and marketing herbal medicine. Thank you all very much. I don't know if we have any questions, any comments. Thank you.